Hey, it's Brian Thomas from the 55 KRC Morning Show with my expert, Valerie from the Visiting Nurse Association. You've seen her before. Welcome back.
Thanks, Brian.
We talked a little bit on the radio today, and you and I have had conversations before, and it's quite often that, sure, the general public may not understand the scope and breadth of the services the VNA offers, but physicians also don't understand, and they are in a unique position to steer and recommend the services that the VNA offers. So with that in mind, let's talk about educating not only physicians but people about the services of the VNA. Hypothetical. You have a heart surgery coming up. It's scheduled, and most people have them scheduled, or even end up in the emergency room on an emergency basis. What do you do afterwards? What would you tell a physician that he or she might need to know to help that surgery patient through the VNA?
Well, Brian, most seniors who are Medicare eligible have complications after surgery or educational needs to learn how to care for themselves. Medicare covers home health services, but there's very strict guidelines. But sometimes those strict guidelines are taken out of context, and so home health is underutilized. Medicare requires that the patient has a skilled need and is homebound.
Homebound.
But homebound simply means they're unable to leave their home for extended periods and they need assistance to leave. And what senior do you know who's been in the hospital who's ready to get up and run immediately after hospitalization?
So they are homebound definitionally.
Exactly. So most patients after a hospitalization are going to meet homebound criteria. Additionally then, the skilled need that Medicare requires includes education about how to care for themselves, about their illness, about how to prevent complications. But oftentimes, that broader definition is not recognized, so home health isn't ordered.
A physician is in a position to recommend it, has probably an overly dramatic version of what homebound needs, and so they don't even bother mentioning the VNA. If you're stuck at home, even for a shorter period of time, you can qualify. And here's the important part that it's worth bringing up, because I can see eyes rolling every once in a while. Oh, well, heck, cost, Medicare's paying for it. Ultimately, you achieve global cost savings because that person's not going back to the hospital, and you're helping them to educate and thus avoid further complications and infections and problems down the road.
That's right. Billions and billions of dollars are spent every year with seniors being re-hospitalized within 30 days because of complications after a hospital stay. Home health services can prevent those patients from going back to the hospital.
Makes perfect sense to me. If you want to get in touch with the VNA, they're on the web at thevna.org, and it's 345-8000, correct?
That's right.
513-345-8000 in the Cincinnati area. Should be happy to talk to you. It's the Visiting Nurse Association doing some great work.